Continuous EEG monitoring is frequently conducted for multiple days. If an MRI or CAT scan is ordered on a patient receiving continuous EEG, MR conditional leads safely allow the electrodes to stay connected to the patient during imaging. MR conditional leads do not have to be reapplied after imaging, reducing the amount of discomfort, skin breakdown, and infection risk for the patient. A patient receiving continuous EEG with MR conditional leads can be transported for other testing without scheduling around the continuous EEG. In addition, MR conditional leads help reduce resource waste, such as time spent reapplying electrodes and technician calls. A patient receiving continuous monitoring will be hooked up with MR conditional leads, allowing for CAT scan and MRI without disconnecting the leads from the scalp. The leads are attached with a hypoallergenic adhesive gel for maximum stability. Only the short electrode set will go with the patient to MRI or CAT scan. The harness disconnects easily and should never accompany a patient going for imaging. Before the patient arrives for imaging, nursing staff will disconnect the electrode sets from the recording harnesses. There should be no connections to the electrode sets during imaging. The electrode wires will be inserted into a blue sponge to keep the leads straight and connectors clear of the scalp and centered to the apex of the head. The nurse will communicate to imaging staff that the patient is being sent with MR conditional EEG leads. Three electrode sets will be disconnected from the harnesses prior to arrival for imaging. The electrode sets will be inserted into the blue sponge at the apex of the head. The harness has a tag indicating that it is not safe for imaging, and the electrode set has a tag indicating that it is safe for MRI. The tag on the electrode set should be verified by nursing before sending the patient for imaging, and then confirmed again by the MRI or CAT scan technician on arrival to ensure patient safety. On arrival of the patient to the imaging department, the technologist will need to first confirm that the patient has MR conditional electrodes in place by verifying the MR tag on the electrode set. Then verify that the connectors and leads are situated at the apex of the head. Last, ensure that the leads and connectors are at the apex of the head when the patient is placed in the MR.